Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Thank you for joining us today. You are listening to Mahaska Health Medical Minute. We're going to visit today again with Patty in our weekly meeting with her regarding our vaccine rollout. I know Patty has been working diligently around the clock and trying to get the best information out as quickly as possible. Patty, give us a little update, and what would you like our community to know?
So we learned Friday that the state heard us and heard all of you that we need to have consistent allocation in the county so we can plan clinics, schedule clinics, and not wait. They listened, and Friday we were given 400 doses that we'll receive each week. That will be, again, for phase 1B, which is the 65 and older, and the tier 1 population, which is first responders, school staff, and daycare providers. That's where we're at. Those 400 doses will be split between the groups. We feel that's a better number than what we've been given before. With that, we have decided to partner with some pharmacies to get those out as soon as possible. As long as we get them out as soon as possible, we'll continue to get that allocation of 400 doses. We have allocated doses to the local pharmacies, which is Mahaska Drug, Hy-Vee, and Walmart here in Oskaloosa.
Obviously, we do not have that date that will be rolled out. Again, just a quick reminder that we do record on Tuesdays, and so information can change daily. But referring back to your last comment about pharmacies, when they are allowed to start scheduling, will our residents hear an update from our public health department?
If you've signed up for the Mahaska Alerts, that message will go out. Vaccine will arrive simultaneously here in the county. So those doses that the pharmacies are getting are from the public health. We are going to be working with the tier 1 work group and some of the 65 and over, but we've asked that the pharmacies, dedicate their supply to the 65 and older population.
We talk about this workforce being 30% of our workforce already is 65 plus. Elaborate on that a little bit. Is that just the workforce in Mahaska County? Because you're covering the 65 plus currently through teachers and firefighters and police. Do you feel you've captured a lot of those 65 plus already?
Yeah, as we work through the tier groups, we have a lot of the 65 in the workforce. So those are vaccinated. If they fit into one of the workforces, then they can get vaccinated, which would be in our 1A group. Currently now, they could be in the 65 and older group as well as one of the workforces. So we have already given a good number of our vaccine. We looked at the numbers and we were about 30% of the people vaccinated in Mahaska County are that 65 and over.
Wonderful. There's just a clear, firm public health action happening across Iowa with all public health departments. You are not new to this. We know you dealt with the H1N1 here in Mahaska County. Although another play that's happening is that second dose is really playing with the logistics and having to be very careful that that's looked out. So it's making the planning a little bit challenging moving forward. Tell us a little bit about that.
The reason we added the pharmacies into the play here is because we are starting on second dose clinics. As we work on second dose clinics and we start prime dosing, which is your first dose, our capacity needs to, we still have other things that we need to do. And the pharmacies, we've been speaking to them, throughout this vaccine period, and we just decided they could help. We've had conversations with them, and we are confident that they will do a good job.
Now, again, just another quick reminder, Mahaska Public Health is following criteria as outlined by the CDC and the Iowa Department of Public Health. I know, Patty, you've looked at every scenario possible. You get calls of every degree. So it's wonderful that you've conquered those messages wonderfully. I hear several comments on how compassionate you are to those patients calling in. Is there anything else that you would like to add? I know your mission is to get those patients in first and your care is on their attention. Is there anything else you'd like to share today with the residents of Mahaska County?
Yeah, I'd just like to say that the goal of Mahaska County Public Health is to get the vaccine into the arms of the people as soon as possible, and we feel like partnering with our local pharmacies will help us achieve that goal to protect our community. Also, one of the things is that, vaccine supply is still limited, so we want everybody to understand the 400 doses will be weekly. That's a good number, but it still is going to take some time to get through this 1B group. We know that the 1A group was about 6 weeks. We know this one is a larger group. So again, until vaccine supplies increase, that was more information too from the state we received that we should be getting more allocations in the state in general, and then that will come down to the county level. So we just want everybody to remain patient, and everybody's been great. We know you want a shot, and we want that for you as well.
One thing I want to ask, I've been seeing this question a number of times, either in the community or media releases, and we don't touch much on a lot of Q&A here with you, Patty, because your role is really getting that vaccine out. But the question I hear a lot is if a patient has had COVID, multiple people are questioning, I don't need to get the vaccine. Tell me what your thoughts are on that.
Through the state, we've been told just because you've had COVID, you can still get the vaccine. We do know, they're learning every day about COVID, that you have a natural immunity for about 90 days. During that 90-day period, that would be, some natural immunity. That starts to drop off. And when that happens, vaccine is important because it gives you a different type of immunity to it. So we want to make sure that you do know it is important to get it, even though you've had it. Waiting until vaccine is more available is not a bad decision, but there's nothing that indicates you shouldn't get it after you've had COVID, only that you're past your 10 days of isolation.
Patty, you're truly the expert on that. And being a clinician and taking care of these patients, you understand that. And you see this every day. To us, it seems like a natural thing to talk about the vaccinations and taking care of the patient, but you truly get that message across on how important it is. Patty, we've heard some news this week. This is also a big news break on the new mask mandate. The governor has really lessened up those restrictions. Tell me your thoughts on that.
Yeah, the Iowa Department of Public Health and the CDC continues to promote masking. So we know that the rate of COVID in the community has dropped a little bit, and we're happy about that. That's with masking. So we want to just make sure that everybody understands until we get a better handle on it, that we still need to continue to mask, social distance, limit your exposures, if you're outside your household members, continue to be safe.
Great information. Good stuff, Patty. Thank you for joining us today.
Thank you.
Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday. Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.